At a time when India is witnessing a surge in COVID cases, rising number of monkeypox, especially among those without any travel history, is a matter of concern. Mirror Now's Swarali spoke to National Institute of Virology Director Dr. Priya Abraham over the two issues to find out how India is gearing up to tackle both concerns.
In a times when viruses are taking a toll on our country as well as the world, we are here with Dr. Priya Abraham. She is Director of ICMR National Institute of Virology, Pune. So let's know from her. People have a lot of questions, ma'am. So we are here to know from you. First of all, there's a confusion between has COVID gone away totally or it's at what stage? So at this point of time, what precautions should be taken and what is its future? And there are a lot of questions about the red flags pattern in it. So please tell us about it.
So COVID has not really gone away. We will constantly be seeing new sublineages of variants emerging. Even as I speak now, we should be both wearing a mask, and keeping that physical distance because it can still infect an individual, but in those who are vaccinated, serious disease is prevented. So I think especially now, from now on, we are going to get into a festival season. We should be careful to, not hang around in places which are overcrowded, poorly ventilated, without masks.
What is it about red flags, ma'am?
Red flag is literally, it's like when we call red alerts. So it's actually cautioning you that red flags in COVID could be suggestive of serious disease or the disease progressing to a more serious phase. So these are examples of red flags. If somebody's breathlessness suddenly becomes worse or suddenly develops breathlessness from when they earlier did not have that shortness of breath, or for instance, they have a confusion in their thinking, they are disoriented in space and time suddenly, or they have severe chest pain or palpitations. In a person who has had COVID, then people can also be having, they might pass out. So these are some, symptoms that need to be studied further by the managing physician to see whether this is going to progress into something more serious. It needs follow-up.
Yes, ma'am. So, who has declared highest alert for monkeypox currently around the globe? So, what are the observations by NIV for India and the current, patterns? Because till now we have 8 to 9 cases, and we have recently got first women to be infected by monkeypox.
So we've had as of now 9 cases. A large number of them are those that came in from another country, but some a couple of them are of non-Indian descent. I mean, they are not Indian citizens, and there is also a case which did not travel, but went to a gathering where there could have been somebody who had that infection. So this is not yet a case for alarm, but we need to be alerted to the symptoms of monkeypox. We need to also be strengthening the laboratory capacity of a critical number of labs, so that at least in every state there will be a lab that can do monkeypox testing, and that is the plan of the government, to expand it maybe little further from even the current 20 labs that have capacity. It might go up to maybe about 30 labs where every state has capacity to screen for such cases. IDSP officials will be are to be alerted, and they will be in charge of collecting samples and sending it to these testing labs, who can then report.
Yeah, so here you have given important information that you are planning, Government of India is planning to expand the
Yes.
testing capacities, right ma'am. So according to the NIV researchers and whatever testing have been done till now, how fatal this can be for India, and on the other hand for vaccination, we are talking about that smallpox vaccination may apply to this, so what's about it?
So, monkeypox, most of the time, is a non-fatal, self-limiting disease. Even deaths in individuals, we have to rule out other causes of death before death can be attributed to monkeypox. That we must keep in mind. So, in that sense, it is not something that should cause that kind of alarm, that this is a fatal disease that's come into the country. No. If you look at the denominator of the number of cases, which are over 26,000, and just a handful of deaths, not even reaching 2 dozen, maybe just about a dozen. The denominator, the percentage deaths are so few, and in those two, we need to completely rule out any other cause of, the person dying while having lesions of monkeypox. So that is one. And your second question, sorry, you had asked me something.
About the vaccination, ma'am.
So vaccine is not, or antivirals are not yet available in our country. Monkeypox is related to smallpox, and for smallpox we had used live attenuated vaccinia virus, and vaccinia virus also belongs to this family of pox viruses. Okay, so yes, the earlier strategy was to use vaccinia virus for mass smallpox vaccination. So that same strategy can be used for monkeypox as well. And yes, I think we will be exploring different options.
Right, ma'am. So, according to whatever you are saying, it will be not as fatal as coronavirus or...
No, not at all. They're two completely different diseases. Yeah.
What kind of precautions people can take in this disease, as we are discussing that it's completely different than coronavirus and it has its own fallout. So how can people get prepared for this?
So these guidelines are clearly laid out in the what was published by the Ministry of Health and Family Welfare. So basically the close physical skin to skin contact with somebody who has lesions, who, if the fluid that comes out of those vesicles, contact with that, or contact with the, like bed linen clothing of somebody who has active lesions, handling that without gloves or any such protection can cause spread. Spread even by respiratory droplets can happen only if you have prolonged face-to-face contact with that with a person who has current infection. So the mode of spread, the pathology, the kind of disease that are completely different.
Right, ma'am. My last question to you is that, as you were saying earlier, that viral research and diagnostic laboratories are also expanding the testing capacity, and NIV is contributing to that process by providing the reagents. So, what's the future plan of action? Like, how many exact laboratories are going to expand this testing capacities in our country, and how will it be all managed? So, will it be like that the final result will be given by NIV, or what? How would it be?
So at this point in time, we have trained. Yesterday we trained 3 more, and that's how I said currently we have 20 labs that are capable of monkeypox testing. And the current plan is we have given them all the reagents, we have given them training. We are on a WhatsApp group, so they can frequently query, ask even the most so-called mundane questions, which we are ready to respond to. So for now, they are supposed to be sending their positive samples and a proportion of their negative samples as well to us. So we verify, and the result is meant to be given out of here. But with time, that may change. When each lab has developed capacity and has shown to be able to accurately test, then they will become completely independent, so that the turnaround time can be, even faster. But I should say, National Institute of Virology, you get a sample late at night, at midnight. You know, people are there in the lab who will test it, and by morning, you know, by 8 o'clock, results will be there. That's really happened few days ago. A sample came from Kerala, and we staff were there at 5 a.m. in the morning, and by 8 I was informed the result. So we don't sit on you know, the testing process. We do it as quickly as possible because we understand patients need to be isolated. A positive case has to be physically isolated till those lesions subside.
Yes, ma'am. So first case in India, death case has come up from Thrissur district, and the 23-year-old man has died. So is there any stage that where we can recognize that the disease has impacted the man or a woman highly, that it can take it to a death? Some kind of observation by NIV in these specific cases?
We have not. We've had one case, that too. You all know that the Kerala state officials are still investigating completely the cause of death. He was quite a healthy young man who became sick for 4-5 days just before he passed away. And he happened to have, and the number of lesions was so few, so few. You know, so and we found another virus, Epstein-Barr virus, also positivity, but even that may not be the primary cause. The real cause of death needs to be elucidated yet. And this patient definitely did not have any other. He was very young, active, physically active, into football and all of that. So he must have had some other complication, is my opinion. But I'm sure Kerala state officials will be able to get more information delving into the case.
From this answer, I got one question that in COVID, we knew that some complexities, you know, add to the intensity of the disease. Like that, in monkeypox, if people have some kind of health complexities, comorbidities, how does it impact, and does it increase the intensity of the disease?
Somebody who, for instance, is very immunosuppressed, or somebody who's an HIV patient, whose infection is not under control because they haven't yet started antiretroviral therapy, or they are not regular with the treatment. So basically their HIV virus loads are not suppressed, therefore their immunosuppression is likely to be significant. So in such individuals, yes, they can have a huge crop of lesions, and it can be like almost like a disseminated infection. But for usually, I mean, most of the time, I would say majority of the time, this is a self-limiting, non-fatal infection.
Okay. Thank you so much, ma'am, for joining us. This is a very, very important information coming in from the director of ICMR NIV Pune, that they are going to expand. They've already expanded it to 20 viral research and diagnostic laboratories where India can test monkeypox samples. And as she has said, that it is not as fatal as COVID, and it has different sets of precautions to be taken. And as she has said, that like COVID, where the comorbidities contributed to intensifying the disease, here low immunity is something which can intensify, but there are no specific details about it. And monkeypox is less fatal, and also about the death which has happened in India. Yet another reasons are yet to be investigated, because this is a major reason, but others are yet to be found out. So precautions are needed to be taken, but monkeypox is not as fatal as coronavirus. This is Swarali reporting for Mirror Now, Pune.